Hello everyone, now let us discuss about CPTs for orthotic management and training, which includes prosthetic training also. Additionally, we will be discussing about medical nutrition therapy, which is also known as MNT. And these topics they come under medicine chapter. Now coming to orthotic management and training and also prosthetic training. Now coming to the CPTs that come under OMT, which is nothing but orthotic management and training and also prosthetic training. There are mainly three CPTs: 97760, 97761 and 97763. The star mark before 97760 and 61 indicates they are also applicable for telemedicine. Now coming to the description of 9770, 97760, it indicates orthotic management and training, including the assessment and fitting, when not otherwise reported. The body parts that are covered under 97760 are upper extremity or extremities, lower extremities, trunk, and this is mainly given for initial orthotic encounter each 15 minutes. These are time-based CPTs. And for initial orthotic encounters for each 15 minutes, you need to code 97760. Next, coming to 97761, it indicates prosthetic training, which involves upper and or lower extremities initial prosthetic encounter for each 15 minutes. This is also a time-based CPT. Next, finally coming to 97763, it indicates orthotic or prosthetic management and or training, upper extremity, lower extremity, trunk. This is mainly given for subsequent orthotic or prosthetic encounter. So for initial encounter, you need to code 97760, and for subsequent encounter, you need to code 97763. All three are time based, and the first two CPTs are also applicable for telemedicine. Now, whenever we consider time based CPTs, one important note is whenever they indicate for each 15 minutes, one unit must be coded for each 15 minutes. And if the time period is less than 15 minutes, that is for less than 10 minutes or 5 minutes like that, for less than 15 minutes, you need not code a separate unit. 15 minutes must be completed in order to code one unit. Now let us say an example. A patient is followed for prosthetic training to her lower leg, and the physician spent 40 minutes of time. Since they are time-based CPTs and you need to code one unit for each 15 minutes. And here the physician spent 40 minutes. That indicates 15 plus 15, one unit for first 15 minutes. Next, additionally, second unit for additional 15 minutes. They add up for 30 minutes and remaining will be 10 minutes. And for this 10 minutes, you need not code one more additional unit. So if the physician spent 40 minutes of time, you need to take only 2 units of 97763. Since it is a follow-up visit. Follow-up visit is nothing but it is a subsequent encounter. So the correct answer is 97763 with 2 units, not 3 units. For 40 minutes, you need to code only 2 units. And the description of 97763 is orthotic or prosthetic management and or training, upper extremity or trunk, subsequent orthotic or prosthetic encounter. The important points that we must consider are the time spent and whether it is a initial encounter or a subsequent encounter. Now coming to medical nutritional therapy, which is nothing but MNT. Now coming to the CPTs of medical nutritional therapy, which is nothing but MNT. There are mainly three CPTs: 97802, 803 and 804. And before it, it indicates star mark and this symbol is also there. The symbol indicates audio only and star mark indicates telemedicine. Now coming to the description of 97802, it indicates medical nutrition therapy, initial assessment and intervention, individual face-to-face with patient each 15 minutes. These are also time-based CPT. Next coming to 97803, it indicates medical nutritional therapy. 97802 is given for initial assessment whereas 97803 is given for reassessment, that is for subsequent encounter. Medical nutrition therapy, reassessment and intervention, individual face-to-face with patient each 15 minutes. And finally coming to 97804, this is coded whenever the physician examines a group of patients, that is 2 or more individuals for each 30 minutes. And for physician and other qualified healthcare professionals who may report the E&M services, they should use the appropriate E&M codes instead of medical nutrition therapy. Now, let us see an example. One important note is for the CPT 97802, it indicates for each 30 minutes, 1 unit must be coded. That indicates less than 30 minutes is not considered as 1 unit for 97804. Now let us see an example. A group of 3 patients are involved in MNT, which is nothing but medical nutritional therapy, for 75 minutes. 75 minutes is contributed by 2 units of 30. It makes up to 60 minutes and additionally 15 minutes will be remaining. And since it is less than 30 minutes, you should not code 1 more unit for those remaining 15 minutes. So whenever it is 75 minutes, you need to code only 2 units of 97802. So the correct answer is 97802 into 2 units, which indicates group, 2 or more individuals for each 30 minutes. Let us see the example once again. A group of 3 patients are involved in MNT therapy for 75 minutes. And for 75 minutes, you need to code only 2 units of 97804. Since it is a group, group indicates 2 or more individuals for each 30 minutes. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.